Hello friends, let's start our new topic which is brachial plexus. It is a very most important topic which come as a 15 marks question in a university examination. So let's start. Basically it is a plexus of nerve which is formed by the anterior rami of lower four cervical and first spinal thoracic nerve. Then we can say that C5, C6, C7, C8 and T1. It has four components. Basically root, trunk, division, cord and fifth component also which is branches. Mainly we can see that the root and trunk basically located in the neck, division behind the clavicle and cords in the axilla. This is the diagram of a brachial plexus. You can easily see C5 and C6 root are formed to form the upper lung, C7 single form the middle trunk, and C8 and T1 join to form the lower trunk. And then all the three trunks are divided into anterior and posterior divisions. See, all are divided into anterior and posterior division, and then the anterior division of the upper trunk and the anterior division of the middle trunk join to form a lateral cord, and all the posterior division of the all the trunk join to form posterior cord, and the anterior division of the lower trunk joined to form a medial trunk. You can easily see and how they are further branching, which in the further branches we will study. See, in roots, root is mainly constituted of anterior primary rami of C5 to T1, and basically it is located in the neck, or we can say that deep to the scalenus anterior muscle. It is a neck muscle. Second, trunk I have already told you that C5 and C6 join to form an upper trunk, C7 alone form the middle trunk, and C8 and T1 root join to form a lower trunk. Then division, you can see each trunk divided into anterior and posterior division, and it is lies behind the clavicle. And cords, you can see anterior division of upper and middle trunk unite to form a lateral cord, anterior division of a lower trunk constitute as a medial cord, and posterior division of all the three trunks unite to form a posterior cord. And let's see its branches, which is a very important. So starting from the root we have two branches: long thoracic nerve, or we can say that the nerve to serratus anterior; dorsoscapular nerve, which we can the nerve to nerve to rhomboids. Okay, and from trunk suprascapular nerve and nerve to subclavius. And the most important branches we will see from here, from cord we have three cord now: lateral cord, medial cord and posterior cord. All the three cord give different branches. So firstly we see lateral cord. Lateral cord easily lateral pectoral nerve, lateral root of median nerve, and one more branch it has, which is called musculocutaneous nerve. Okay, next we move on to the medial cord. Medially why same है. Medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial root of median nerve. All the four MRAM or ulnar nerve. You can easily revise if you are focused, then you can easily remember all these branches name. Posterior cord you learn from here. See, upper subscapular nerve, lower subscapular nerve, then nerve to latissimus dorsi, axillary nerve and the radial nerve. And ulnar nerve हमारी कहाँ पे आ चुकी थी? Median cord में. Okay, let's see its applied aspect. First we will see the Erb's point. Erb's point basically it is a uh, region where three nerve meet, means that C5 and C6 and the anterior and the posterior division and the suprascapular nerve and nerve to subclavius nerve. All these are meeting point. It is called the Erb's point. Okay, it can become as under a 3 marks question. Very important question it is. Next we will move to the Erb's paralysis and Klumpke's paralysis. First we will see the Erb's paralysis. Erb's paralysis can be due to excessive increase in the angle between our head and our shoulder. It basically involves the upper trunk. Upper trunk हमारे पास क्या क्या होता है? C5 and C6. ओके, इसमें हमारी टिपिकल डिफॉर्मिटी ये आती है कि हमारे हैंड जो होते हैं वो हमारा पुलिसमैन टिप हैंड हो जाते हैं, एंड पॉटर टिप हैंड हो जाते हैं, एंड हमारा वेटर्स टिप हैंड हो जाते हैं. ओके, इसके अंदर हमारे बहुत सारी नर्व्स जो होती है, सॉरी मसल्स जो होती है, वो हमारी पैरालाइज हो जाती है। डेल्टोइड मसल, सुप्रास्पाइनेटस मसल, इंफ्रास्पाइनेटस मसल, बाइसेप ब्रेकाई मसल, ब्रेकियलिस मसल, ब्रेकियोरेडियलिस मसल्स, many more muscles are involved in this. Let's see one by one. Adduction of arm. Adduction of arm is due to paralysis of deltoid muscle. Medial rotation of arm, we see that this placement tip hand is due to the adduction of arm, medial rotation of arm, extension of elbow, and the pronation of the forearm due to all this. So adduction of arm is due to deltoid muscle. Medial rotation of arm is due to supraspinatus, infraspinatus, teres minor muscle. Extension of elbow is due to bicep brachii muscle. Pronation of forearm is due to also due to bicep brachii muscle. You can easily see this diagram. See how it's have a adduction of arm and how it is medial rotation of arm. This is Erb's paralysis. Let's move on to Klumpke paralysis. Klumpke paralysis is to hyperabduction of arm, and the nerve root involved in it is C8 and T1. Claw hand. Why claw hand? Due to paralysis of flexure of wrist and finger and all the intrinsic muscles of the hand. We know all the intrinsic muscle of hand इसके कारण होता है हमारा. And sensation loss of sensation भी हो जाता है हमारा medial border of hand and forearm के आसपास से. Horner syndrome इसका बहुत एक characteristics autonomic sign में हम बोल सकते हैं. Horner syndrome आप further पढ़ेंगे, आप जैसे आप बढ़ेंगे आगे, इसमें partial ptosis, anhydrosis and anophthalmos, ये आप याद रखिए 3 point. Partial ptosis, anhydrosis, anophthalmos, and you can see the claw hand. This is claw hand. In claw hand there is a hyper extension of the metacarpophalangeal joint and the hyper extend flexion of the interphalangeal joint. Okay. And finally, if you will see the difference between, this table is very important. See, nerve root involved in the Erb's paralysis. We have already seen that the upper trunk is involved, means that C5 and C6 uh, trunk is involved, and the Klumpke paralysis lower trunk involved, means that C8 and T1 spinal nerves are involved, and the muscles paralyzed. I have already told that in the Earth paralysis, deltoid, supraspinatus, infraspinatus, bicep brachii, brachialis, brachioradialis, supinator, extensor carpi radialis longus, all these are involved. And Klumpke's paralysis, अभी अभी हमने देखा है that all the intrinsic muscles of the arm is involved. Position of the upper limb, we have already told that the policeman tip, potter's tip, waiter's tip. In the Erb's paralysis and the Klumpke paralysis, there is a claw hand. Sensory loss we can see in Erb's paralysis the outer aspects of the arm, and Klumpke's paralysis we seen that the along the medial border of forearm and hand. Autonomic sign, Erb's paralysis there is no sign, but Klumpke's paralysis there is an autonomic sign which is present as a, I have already told you that, Horner syndrome. In this three, partial ptosis, anophthalmos and anhydrosis. These 3 points you have to remember in Horner syndrome, and as soon as we will study further we can learn more about Horner syndrome. Okay, thank you for today.